We will deal honestly with the American people. And we'll never, ever, ever quit. That's how we'll shut down this virus.
I'm going to shut down the virus. I'm not going to shut down the economy. I'm going to shut down the virus.
Let's open up Outnumbered. Chris Bedford.
You got to wonder how he's going to be able to pull this off, Harris. How he's ever going to shut down the virus. I know they took a break from trying to control the global climate, but this seems even a stretch by that. The problem I think that we're facing here is a lot of COVID really at this point is a social construct. When it comes down to testing, when it comes down to contamination, when it comes down to lockdowns, if we tracked any other communicable disease in the same way that we track COVID, where you have to be isolated, your family has to be isolated, you have to be going through these tests, I think there would be a panic all the time. We're not going to get rid of this disease, but the people who are pushing this, especially where I live, where you live, they are so wedded to the idea of these lockdowns, these mask mandates, these school shutdowns. They've never worked. They're embarrassed by that. They can't admit it, so they're doing it again. We just started the new mask mandate here this morning in D.C. D.C. Public Schools just announced that they will be shutting down again. None of this has ever worked. It's hurting children. It's hurting businesses. It's hurting America. But if they won't let go of that and follow the cues of, say, Ron DeSantis, who's actually trying to help the people of his state, then they're never going to get anywhere. And Florida, by the way, has a very low COVID rate. I know people like to say this because they're outside. I just got back from Florida. Those bars and restaurants and concerts are packed indoors, but they've got a different strategy of dealing with it, and because of that, the panic has actually gone away.
So what's interesting about some of what Chris is saying, Kayleigh, is, you know, with regard to what we learned, some people, some governors, some states learned from the last 2 years. Not so convinced, some of the American people say, that the president and other Democrat states did learn. But New Jersey is a cobalt blue state. Our Governor Murphy there, not doing the lockdowns. He's not following these East Coast governors anymore. We don't have any of that. And we can get monoclonal antibodies, and we can get those things that we saw down in Florida. It's interesting.
It is interesting, and you see red state governors like DeSantis doing a fantastic job. Chris Bedford is right. I'm a Floridian. I've seen it firsthand. There's a balance between freedom and between COVID restrictions, and he seemed to have found that balance, and the numbers bear out. He's done quite a good job. Also, I want to lay the foot of blame of a lot of this at the seat of the federal government. I talked to someone who was a high-level official that I worked for in the federal government, and I said, explain to me what is going on right now. Explain this to me, because when we were there, I remember I saw these officials come and sit down with me and say, down to the hospital level, not county level, hospital level, we're able to see what supplies they have, what they don't, work with the private sector and surge supplies. Okay, well, what's the difference between what happened then and what happened now? Key to making sure that tests are being produced is communicating with the private sector, which the Trump administration did daily. Abbott, who we know has that rapid test, about, I was told, June, July, stopped producing this rapid test at the scale needed because they were not receiving communication from the federal government, where President Trump purchased 500 million Abbott tests, giving a signal, produce, produce, produce. The Biden administration, I was told, to this day, has not done that. So when you're not surging money, when you're not giving an indicator to the private sector, we will get these tests, we will distribute them, you have a problem. And why are we sitting here in December, and now Biden's saying, I'm going to purchase tests, I'm going to communicate with the private sector? He had 12 months to continue the good work of the Trump administration and did not.
12 months by your source, that former Trump official, but at least 6. I mean, I look at our state of New Jersey. You can call the hotline, you can go on the website, you can get a home test sent to you, as many as you need in your household. You've been able to do that in several states. I mean, the White House is behind it. Now, they're expected to announce that 500 million haul of tests that can be sent to your home now. But it's supply chain crisis holiday season. I mean, everything takes a little bit of time. Is he going to come to my house with it in his pocket? Maybe Amazon's got a deal because they're the fastest in the business. Look, I'm being honest here. Like, he's behind the times. And Kayleigh, you got some of the receipts for that. Kennedy.
Yeah, and by the way, this virus is having its way with people. It is mutating. I know that Joe Biden wants to take it behind the woodshed and punch it in the face, but that's not necessarily happening now. And I would like more doctors to be honest about what's happening here, because
Science.
there is an inverse proportion between transmissibility and death. The more transmissible the virus is, the more people who get it, the more contagious it is. It looks as though, and we're seeing a lot of research like this out of South Africa, more people are getting it, younger people are getting it, but their symptoms are not nearly as bad as they were in spring of last year. That's good news. And it also means that the virus can shift from a pandemic to an endemic, which means it's something that will always be with us, that is more manageable. But, you know, to Kayleigh's point, the federal government has to get out of the way if they are not helping. And, you know, right now, not only are we hearing about low orders, we're also hearing about supply chain backlogs on some of the testing equipment. So that's another reason you're seeing such long lines at testing facilities.
And what about this, Kennedy? Because I know you've been interviewing on your program Doctors McCary and Siegel and others as well. I enjoy talking with the Dr. Jha as well whenever we can make the time for each other. And so you talk about supply chain issues. They're big on that pill, especially Siegel. They're big on that Pfizer pill because that puts another therapeutic in there. Where is Biden on this issue? Is he going to announce that there'll be expeditious delivery? Is he going to push the FDA to not take it as long as it did to even get to the point where that was mainstreamed for the vaccines, where we could get them and it wasn't always an emergency authorization?
Yeah, and that's a great point. And that's another thing, you know, when I talk about the federal government getting out of the way, get the FDA out of the way. Stop stepping all over your own message and just make sure that this therapeutic can get in the bodies of sick people, because it is the thing that is keeping people in the hospital from dying. You know, that's in addition to the vaccine and all the science we have that corrected some of the stuff about barriers and things that were superfluous that weren't helping us. That pill will save lives, bottom line. So get that emergency authorization, please.
Or at least push for it. I mean, Tommy, I hear, you know, the White House will say, well, it's not our position to tell agencies what to do. Well, they can suggest, can't they? I mean, a suggestion from the White House has to mean something. Well, unless it comes to Build Back Better. Maybe not then.
That's very interesting, because they don't want to tell agencies what to do, but they have no problem telling the American people what they should do. You know, we know that we're going to hear from President Biden a stark warning for the unvaccinated, but I'd also like to point out, in the midst of also a supply chain crisis, but we've got hospitals now, they're worried about them being overwhelmed. Let's not forget, it was this administration that was pressuring those healthcare workers to get vaccinated or else be terminated. So now we're going to be in a position where we might have long lines at hospitals, we might be short-staffed at hospitals like we are everywhere else in this country, and you had an administration that was threatening to terminate those very people that are essential, that we very much need, not only for Omicron and for COVID, but for everything else. So let's keep that in mind. But I agree with Kennedy. We should not be pegging our lockdowns and our mandates and our restrictions on case totals. We should be pegging them on mortality and death rates. If we've got something that we're living with that is highly transmissible, but the symptoms are mild, and it's not killing people at the rate that we saw with the earlier versions of COVID, well, then that in it itself is an accomplishment. So we should be moving forward with life, understanding we're going to have to live with COVID, stop bullying the American people into doing what this administration feels is best, start giving people liberty and personal and medical freedom, and let's move on with our lives.
Yeah, we're never going to get to zero COVID. We're never going to get to zero stupidity. We're never going to get to zero anything. But those types of goals for learning to live with things, that's what we do with other diseases.